And around 4 to 5 years, they should start using sentences that give lots of details, so use a lot of adjectives and as well as verbs, so it's more detailed sentences like the biggest elephant has giant tusks, those type of connecting sentences as well. And they should be able to tell stories that stick to a topic now. So remember, back to our social rules of language, they should be able to use language in the appropriate context, social context at this stage. They should communicate easily with other children and adults as well. And by the age of 5 years, they should be able to say all their sounds correctly in English, okay? Because I'm only referring to the English language in this case. So the complicated sounds like L, S, R, V, Z, F, Ch, J, Sh, Th should already be established by this time. They should be able to start naming some letters and numbers. And they should be able to use the same type of grammar that's being used by the rest of their family members. Receptively, they should be able to pay attention to short stories and answer simple questions, so just by hearing. And they should be able to understand most of what is said at home and at school as well. So what can you do to help in this case, okay? Again, playing with your child. This comes across all ages. The types of games you should encourage include board games, so Monopoly and all those type of board games where you can include a lot of people, and you can also have a lot of turn-taking things in here. And have step instructions. You can even ask them, explain the instructions to them and get them to tell you how to play it as well. And pretend play and role play. So you should always start from 3 to 5 years. They should be doing a lot of pretend play and a lot of role playing. So there's a lot of opportunities to use language when we do pretend play, and there's also a lot of opportunities to model good language when we do pretend play as well. I know I did a lot of this when I was little, to play doctor, teacher, those kind of games. It's really good. And if it's okay, I'm not really anti-gadgets. It's okay to let the children to play with iPads and all that. They do learn quite a lot from it, but try and limit it and try to encourage more of the actual human-to-human kind of play as well. Offer descriptions or clues and have your child identify what you're describing. So rather than always asking them what's this or what's that, you can also give them, this will develop their thinking skills, so give them some description and get them to guess what you're saying. So for instance, what lives on a farm, eats grass, and drinks milk, and you can switch roles. Get them to describe and then you guess. You can do those type of things. So work on forming and explaining categories. So we talked about sorting out categories for the previous age group. But for now, you can get them to take it a step further by explaining the categories. So what do all these vehicles, what does that do? It's to take us from one place to another. And also start teaching concepts. So location words, like all your prepositions, like I'm sitting under a tree, the ball is on the table, those type of words. And opposites, adjectives, those type of things. And do a lot of storytelling. So you can start by storytelling, you don't even need to do just storybooks and all that. You can even do things like sequencing what you're doing. So let's say if you're taking a bath, so what do you do first? So get the child to verbalize what they're doing. So take off your clothes, go in the shower, shampoo your hair, those type of things. Get them to say, or how to make a sandwich, You get them to take the bread and talk while doing these things, yeah? And give full attention to your child when he or she is speaking. Praise and encourage him afterwards. And always remember to be a good listener as much as being a good model. So you always have to give your child a chance to speak, okay? Rather than just talking all the time at them. So that's it for today. The conclusions are, here is children learn language by experiencing the world. So as much as possible, children should hear, feel, see, taste, and smell the words to get a better understanding of what the world truly means. So the approach to learning should be multimodal. So everything, we don't just learn by hearing, we also learn by seeing and by feeling. So it's important to expose your children to all of these things, yeah? And human interaction is key. You have to spend time with your children and talk to them. You have to play with them. And I really cannot stress enough on the power of play. It's really, really important. And if you feel like your child's not meeting any of the milestones or is slower, please sought for help. Don't always think that they're going to grow out of it. So, you can get help from pediatricians, or you can also come to us, speech therapists, and we can provide you with a proper diagnosis and the intervention. And early intervention is really key. The earlier they get the help that they need, the higher their chances are to excel. Yeah? Okay, so do you guys have any questions for today?
Hello, good morning.
Hello.
Yeah, I'm YP here. I have a question because my eldest son now is 3 years old. We noticed that he starts to stammer.
Okay.
When he tries to speak at the age of 2.
Right.
Yeah. First of all, I want to understand stammering. Is it part of the speech problem?
Okay, stammering, also known as stuttering, it's a neurological problem. So it's not anything that you've done, it's not a psychological thing, it's actually the way that our brain matures. So maybe the way that our brain matures is there are connections in the brain. So sometimes when these connections are not fully connected, then they might develop stuttering and all that. So it is neurological. And there are ways that you can help your child. Number one, don't put them under pressure. Don't say, oh, don't repeat after me, that type of thing. Just get them to, when he does stutter, just get him to start again. Or he's 3, and how bad is the stuttering?
Okay, I will give you an example when he wants to call his daddy. I mean, at home we don't call daddy, we call papa. So it will papa. But when he tries, you can see he's struggling, pa, and you can see the nerve and the neck there is coming out.
Right. Okay, very strange, right? Well, those are common features of stuttering. But even with stuttering, there's varying degrees of stuttering, like severity, in terms of severity and all that. So he'll definitely need to get assessed. And at 3, he should be getting assessed at this age. If it's any younger than that, then they might grow out of it. But if by 3 they're still doing it, and how often is this happening? Is it all the time or just occasionally?
I would say 7 out of 10 times when he tries to call out. I mean, at times he can speak fluently, but at times, normally it will be the first or the second word he will start to stammer. Only after that it will be fluent.
Okay. Well, 7 out of 10 times is actually quite high. If it's just occasional, I wouldn't be too worried, because some kids, they do take a bit longer to get their fluency going. So I would suggest for you to take him for an assessment. And there are programs for stuttering. Because as you know with therapy, it's not like a magic pill that we can give your son to stop stuttering. So it will be a lot of effort on his part and also on your part to get over the stuttering and to so that you can learn strategies to control the stuttering behaviors.
So it means this can be rectified 100%?
Well, I can't promise you that it can be rectified 100% because it really depends on the child. But oftentimes there's still some chance of it actually being eliminated before the age of 5.
Before the age of 5.
Yes.
Okay. The last question is that we do not know whether, because at home we speak English and also dialect Cantonese, but we bring to babysitter, we speak Mandarin. So will this three languages at very early stage like confuse him, that makes him stammer?
No, that shouldn't be the cause. Bilingualism, trilingualism is not a cause of stuttering.
Yeah, thank you very much. It
Okay,
means
you're
that at the age of 3, I should let him as well.
Yes.
Thank you.